Now you say that as the troops are withdrawn, that you would replace them with a security force. Now where would that security force come from, and how long would they have to be there?
The only way you get them to come is to end the occupation. They would come from nations of the region. Half of the nations, half the troops would have to come from Muslim nations. They would come as a result of working with Syria and Iran. And Iran is very important in developing a solution here. I mean, we are long past the time when we should have reopened diplomatic relations with Iran. President Bush's policies of confrontation with Iran are a dead end. So you get help from all the nations of the region to serve as peacekeepers to move in as we move out. Now, how long do they have to be there? As long as it takes. I will tell you this, with Iran's involvement, that they can be very influential with the Shiites in Iraq, and with Syria's involvement, they can be very influential with some of the groups in Iraq. And I think that we have the potential of being able to get the world community in, but particularly the region, to get the troops in. I asked people at the UN whether it was possible to mobilize such a force. They said yes. They said it wouldn't take as many as U.S. soldiers would take. And the very fact that the U.S. would be leading would be a cause to try to push for a ceasefire as the first step towards creating peace. But the first thing is to end the occupation. And what the Bush administration has done is they've equated the occupation with some kind of an overarching cause for the United States to stay in the region. They're saying they equate the end of the occupation with surrender. Well, the truth of the matter is we're illegally in that country. We don't have any right to be there, and we have to get out. This isn't a war so much in Iraq as it is an illegal occupation.
So none of those people, none of that force would be American troops?
No. No, I mean, the idea is to get out.
I think one of the other insidious effects of this occupation is the impact on domestic policy. I think some of my healthcare friends here today, I'm a pediatrician at the county, and actually on the child abuse team, so the programs we speak of, unfortunately, are being defunded, because we're paying for this war, and I just wonder what your healthcare policy, more about your healthcare policy.
Thank you very much. First of all, thank you for serving children. Pediatricians are the angels of healthcare. They take care of these babies, and thank you for doing that. And wouldn't it be nice if all the children of this country could have their health care in peace? They can't today. I want to talk to you about our healthcare system. And again, why my candidacy represents a real and profound shift in the way America relates to healthcare. Here are the figures. 46 million Americans, no health insurance. 50 million Americans, underinsured. Half the bankruptcies connected directly to people not being able to pay their hospital bills. 3/4 of those bankruptcies relating to people who are working people. Foreclosures at an all-time high because people are so strapped for money they can't even afford to pay their mortgage. This is all related to a system where healthcare dollars are accelerating to the top in a for-profit scheme. How does it work? America spends $2.2 trillion a year on healthcare. Of that amount of money, 31 cents on a dollar, according to a study by Harvard University, 31 cents on a dollar goes for corporate profits, stock options, executive salaries, advertising, marketing, the cost of paperwork, in the private sector, 15 to 30%. If all that money that is now involved in for-profit medicine was taken, in this case $660 billion, and put into health care, so that all $2.2 billion was spent for health care, here's what we have enough money for. Every person in America would have basic health care needs covered, plus everyone would be able to have access to vision care, dental health, mental health care, long-term care, and prescription drugs. Fully paid. That's how much money is in this system. In this campaign, you will hear every candidate for president saying, I'm for universal universal health care. I'm for universal health care. And I'm for universal health care. Even the insurance companies are for universal health care. As long as the government is subsidizing the insurance companies to provide minimal coverage for millions of Americans, the insurance companies think that's the greatest thing going. In this campaign, this is the defining domestic issue. Because what some of the leading Democrats are saying is, we had a health care debate a month ago in Las Vegas. Senator Kucinich and Senator Edwards are both talking about plans where the government will insure more people by paying the premiums to private insurance companies. Now, let's talk about the problem here. It is the fact that people are paying premiums that are going through the roof. It's the fact that if somebody is paying your premium, you're still stuck with copays and deductibles. You can have copays that can take you, that can break you. You can have deductibles. If you have somebody who's really sick, maybe it pays 80%, you're stuck with 20% for something that could cost, $100,000, you're out of luck. $20,000, that could break most people. And so, but in some cases, the bills are even bigger. People are finding they lose their jobs, they lose their health care. People are finding they have a pre-existing condition, they can't get the care they need. Massachusetts adopted a plan to provide health care for more people. Suddenly, the plan starts to shake apart because there are people who couldn't afford the basic insurance that the state was providing. Senator Edwards' plan provides people have to buy health insurance. You have to either get it from your employer or you're going to buy it yourself. So if you can't buy it, it's illegal, right? You broke the law. And the point is that all of these schemes have one thing in common. They want to keep the for-profit healthcare industry alive. It's not about healthcare for people, it's about profits for the insurance companies. So what happens? Healthcare, the insurers, we all know how they make their money. They make their money not providing healthcare. I mean, that's the nature of the business. They have teams of people who are trained to disallow claims. If any of you have ever had to fight on a claim, you know what I'm talking about. This is a $600 billion a year business. So what is this plan I'm talking about too? This plan, by the way, is embodied in H.R. 676, a bill that I'm the co-author of. It's the Kucinich Medicare for All bill. And this bill has 63 members of Congress supporting it right now. And this bill has 14,000 physicians supporting it, 250 labor unions supporting it, all kinds of community groups behind it. Why? Because people realize this is a defining economic issue. Think about it this way. Suppose America, like every other industrialized nation, covered health for this country. We are already spending 16% of our gross domestic product. We spend twice per capita than any other nation that covers its people 100%. But think for a moment, you who are already paying $5,000 a year, $10,000 a year, or more, think what it'll be like to put that money in your pocket instead of paying it over to an insurance company or a hospital. Think of what it's going to be like when families have that money. When people, if they need long-term care, don't have to go to the nursing home and say, okay, here's my income statement. Here's what our home is worth. We've worked to have this home for 30, 40 years, but here it is. And, gee, I hope we really don't have to start tapping the equity in that house because, God, we worked on it. And if my loved one gets well, we really want to back to that home. We can't go through this again. We've got to stop this healthcare system that's impoverishing people. And that's why my candidacy as president, my election as president, is transformation for this country on a major issue that's of social and economic importance. There's no other candidate who can claim this. All the other ones are ready to capitulate to the insurance companies, even to the point where my friends, and they are my friends, Senator Clinton, Senator Edwards will say to a national television audience, this thing just isn't going to happen. So let's try what's doable, like, subsidizing the insurance companies. Brilliant idea. So, this is a defining issue. And this isn't about me, by the way. This is where we have to get the word out. How serious are people about their own economic welfare? How serious are people about holding on to their homes, holding on to what they've worked a lifetime for? I mean, you're the ones that have to help me carry this message on. Any other question about the health care plan? Anyone? Christine?
Can I say something? I know something about